Well, of course, if you can shut it down in a cluster, you can prevent it from spreading more widely in the community, right? And so let's just, I don't want to say compare and contrast, but let's just compare the situation with another cluster outbreak that occurred at the University of Memphis in August and September of 2020. Had a very large cluster there, this wild type Wuhan, regular COVID, but it was a very large cluster. And obviously all of us learned a lot in the effort to control that. And then in February, we had a new cluster at the University of Memphis, also in the athletics department, and it was being driven by that highly transmissible UK strain. But it was early recognized, it was early sequenced, the information was shared quickly from the laboratories to the university, and the university and the health department had, building on our relationships from the summer and the last outbreak, had really gone through already what the best practices were for contact tracing and isolation and quarantine measures. And the university was able to build on their experience from the past and be very aggressive about isolating cases and putting contacts in quarantine. And then the laboratory system was invited to come in and help them with testing. A very large number of people in that department got a test to know their status. Once again, know your status is the first step. So it was a collaborative effort from many partners to just lock that cluster down. And even though it was a strain of the virus that was 3 times more transmissible, the size of the cluster was less than half as large as it was in the previous experience in August and September. So kudos to the university, congratulations to them, they did a great job.